you should understand why you're even reading it. So that, when you stand anywhere, they ask you, what is medical humanities? You should be able to say something. Okay, so first of all, before we go into medical humanity, let's look at one of the areas we used to define naturopathy. Okay, naturopathy is a form of holistic medicine, okay, or it's a holistic approach to healthcare that treat the whole person. So naturopathy also believes in holism. That is one of the philosophies of naturopathy, holism. And when you say holistic, it means that we are talking about the whole person, the body, mind, emotions, and spirits. And we also talk about the social life, the financial life, and anything that comes together to make a human being a person. Okay, all right. Now, as part of the whole person concept, there's this aspect that the mind and emotions. The whole person is made up of the body, mind, or mental, emotions, and spirits. So under medical humanities, we are throwing light on this aspect of the holistic person, that is the mind and emotions. That is why we are treating this course. Okay, so in the definition about holism, we talk about the mind and emotions, the body and the spirit. So we are looking at that aspect of the person, that is the mind and emotions, okay, under medical humanities. So the reason why we are treating medical humanities is that the person who comes to your hospital or healthcare facility to be treated has a mind, has an emotion, or has emotions, and then is being governed by his mental faculties. So as a practitioner, the aspect of the person that controls his body is what we are trying to study under medical humanities. Okay, so we are not just studying this course for studying sake, but we are studying because as a practitioner, you need to understand the emotions, you need to understand how the mind controls the body and even our health. One of the modalities under naturopathy is called mind-body therapy, where we harness the power of the brains to control the physiological processes and activities of the body. Okay, great. So studying medical humanities is not out of place. All right. So when you talk about, we also said that when you talk about humanities, the word humanity come from the Latin word humanitas, which means human nature or human quality. It means that the person who is sick and has come to your facility, there's a particular way the person behaves and thinks. Okay. And as a practitioner, you should understand why the person is thinking the way he's thinking. Can you imagine that the person comes to your consulting room, you finish with the person, you ask the person whether the person has any question or any concern, he said no. Then whilst he leaves your room, he goes to the nurses. This patient start asking questions which he should have asked the doctor. So you ask the person, why did you ask the doctor? He said, well, I don't even know. It's not true. The person knows. But the person is a human nature that sometimes they don't want to ask the doctor any question. Okay, they rather want to go and ask the nurses. Or sometimes the patients coming to your consulting room, he sees you as a big person that he cannot ask you any question. Okay. Or a female patient who has gone to see a male doctor, and certain feminine characteristics. Because of the human nature of this woman, is unable to ask the male doctor, and vice versa. A male patient go to meet a female doctor. Certain masculine questions, or yes, anything that bothers on male characteristics. Some human beings feel shy, okay, to ask the opposite sex or gender. So the question is, you are dying, you are sick. Why should you allow your shyness to affect your health? So that is about medical humanities, okay? So we also say that humanities is not just training the person to get knowledge, but it helps the person to develop their critical thinking, creativity, communication, and empathy that can be applied to any field of endeavor. The word empathy means putting yourself in the shoes of your patient, okay? All right, so we said that medical humanities is using the arts, ARTS, literature, history, and ethics to understand the human side of medicine. Okay, so the person who has come to you, the person can be the president of the country. Okay, he visits your hospital with his security protocol. Meanwhile, the person is sick. Okay, so you trying to understand the human side of medicine. That is where medical humanities falls under. Okay, the person. All right, so we try to look at why is it important to study humanities, medical humanities. One, it says that it humanizes medicine. Medical humanities humanizes medicine. What it means is that a practitioner who studies medical humanities, you feel the pain that your patient is going through. You can feel the anxiety the person who cannot sleep is going through. So it makes you, the practitioner, behave like a human being. You express respect, dignity. You learn how to communicate to your patient because you know that one day you can also be in that state. So studying medical humanity makes you feel like a human. So if you are treating an elderly person in your consulting room and maybe your parents are alive, you see that person as your parent. If that person was your mother, how would you have treated this person? Okay, so studying medical humanities makes you, behave well as a human being. It also makes you improves and strengthen your level of empathy. You feel for the person. Okay, if the person says he cannot take your medicine because it is bitter, don't insult your patient that even children are drinking this medicine. Why are you an adult? You are afraid of medicine. No. Maybe throughout the life of this person, he was not exposed to bitter things. Now the medicine you have to take to cure is bitter. You have to develop a psychological strategy to let the person accept your level of thinking to take the bitter medicine. Okay, so medical humanities makes you feel strongly for the person and understand their state. It also makes you understand the whole person. So the person comes to your facility, the person says he cannot walk. You, the practitioner, you have to support the person, hold the person tight to go and sit in his car. Some people ask you, why should a doctor be doing that? Because you have studied medical humanities. It is making you feel for the patient. We also study certain terminologies like what it means by scientific study. Okay, where we say that when you say scientific study, it means the application of investigation, observation, experimentation, analysis, and understanding phenomenon, okay, in your activities. So anytime you are trying to investigate something through observation or experimentation, or you analyze what is in front of you and trying to understand the phenomenon that is happening, it means that you are applying scientific studies to your work. We also look at the mind. What is the mind? I try to explain that the mind is different from the brains. In fact, the activities of the brains is called the mind. You cannot hold the mind. You cannot touch the mind. You can't touch somebody's memory. You can't touch somebody's critical thinking. You can't touch somebody's ability to reason and do calculations. All this is being done by the brains, and when these activities are going on, we call it is the activities of the brain. That is the mind. So your creativity, ability to solve problems, image drawing, or you capture image in your brains, that is the mind at work. Okay, so if we link the brain and the mind, as we link it to, or we juxtapose it to the computer, we say that the hardware, the monitor, the keyboard, the mouse, and the CPU are the brain, and then the software that is running through the computer is the mind. Okay, and then we also try to understand what human behavior is. It says that human behavior is a mixture of needs, our emotions, and learned habits. And these are driven or triggered by internal and external factors. And they are aimed to help us achieve desirable outcomes, okay, with people often acting on quick emotional response rather than just deep logic, okay? So we try to understand what human behavior is. Human behavior is the way we act, okay, and the way we respond to things. That is our behavior. Okay, well, so we also try to look at what human behaviors are. So a behavior is how someone acts. It includes all the actions and reactions of individuals or groups that can be directly observed and measured. Okay, so we also look at what triggers some of our behaviors. And then we concluded on introduction to psychology, where we said that psychology is the scientific study of the mind and behavior. Okay, so anytime we want to understand the way the mind is working or our behavior, you are just, applying psychology to your work. Okay, so for instance, you are a CID detective or a police officer who want to investigate how somebody thinks or feel, or why the person behave in a certain way. Then you are just applying psychology. You want to understand, for instance, in your class now, some people's behavior. Why is it that we say we should mute our microphone? Yes, some people's microphone will be on. Why do you want to open your video? Why you want us to see your face? Well, there's nothing wrong. But the question is, why are you acting that way? So the moment we want to investigate why Mr. A always want to on his videos, then we say that you are trying to apply psychology in the way you are doing your things. Why do some people remain quiet in class for a group discussion? Why some people want to prove to other people that they are more intelligent than the others? Even when the lecturer is saying, don't talk, we want those who are not talking, they still want to prove that they are also there. In our companies, why do some people want to prove that they are more powerful than the others? Okay, I remember in my place of work, one of my colleagues was promoted to deputy manager, and it came with some incentives. He was giving clothing allowance. Now this guy started wearing nice suits, and I was wearing the normal African wear. This guy could now talk to me as if I am a cleaner or I'm a beggar. And I told the master, we were in the same department, and the CEO, maybe through your other means, hard work or something, he has elevated you. It doesn't mean I'm your servant. Okay. So the question is, why is that person behaving like that? Meanwhile, another friend of mine was also promoted. He was still coming to us, and then we ate together. I was also promoted above some colleagues of mine. We will go and sit in the same public transport. We'll go and eat for lunch, and then we come back. We didn't see ourselves as different from those people. So under psychology, you want to understand, why do people behave in certain ways? The small power you are given at your place of work, you want to prove to everybody that you are the Oga. Okay. So please, those of you who own facilities, medical humanities will let you understand why sometimes your workers behave in a certain way. You were traveling, and then you nominated one of the workers to take over your office. Whilst you are away, you start receiving reports that now this guy has started controlling everybody's behavior. He now wants to even change the way we dress. He wants to even tell us that the time we go for lunch is too many. We should reduce it. Hey, meanwhile, even the owner of the work gave us 1 hour to go and have our lunch. You are just an acting head of department. Now you want to reduce the 1 hour to 30 minutes. We said we no go agree. So we called the CEO who intervened and told the acting that, look, master, allow them to work. Let them have the 1 hour. When I come, we'll have a meeting. Okay, the question is, why do people behave in a certain way when they are given opportunity to lead a group of people? Okay, among your groups, the group leaders, please use psychology to handle your group people. Okay, don't be a bossy or authoritarian, and then it's like when you say something, nobody can question you. We are all students. You have been made a group leader, let's say group 2 or group 3 leader. Now you don't want us to brief. When you give us a task to go and do, and the time is not, you are calling us, hey, are you working on it? I don't want to receive any excuse. Master, just can encourage your group members to work, okay? And you're going to be fine. All right, so that is about psychology. So psychology studies the mind, our behavior, and we use scientific means to do so. So we are going to look at the mind. What is the mind? Okay, so your ability to think, feel, perceive, or imagine, or remember something is the part of you called the mind. This evening, will you believe that there are some members in class who have forgotten that this evening we have a class? So ability to remember things is the part of your makeup called the mind. Ability to reason, perceive things, think or feel, okay, is that aspect of your system called the mind. And psychology wants us to understand it. Why do you behave the way you behave? Okay. All right. So, and then we also look at let me see what influences the mind. Okay. Okay. So now I gave an assignment. And the assignment was this: discuss therapies that are controlled or influenced by the mind, and then explore how one of these therapies works to achieve optimal health. Please, who was able to read or work on this? Yes, Mr. Ambrose, your hand is up.
Yeah, Dr. Ross.
Yes.
Thank you. From what you were saying, I wanted to ask a question before we get to this side. I don't know if I'm clear.
There's noise at the background.
Dr. Thompson, you were in the fill out. Let me move from here. All right. So I was trying to ask myself that from what you were saying about human behavior, like when someone is given a little position over maybe a group of people, and, some of them behave the way they behave. My question is, why is it so that also most of the times people that are able to identify such people are being hated most? Let's assume I'm the group leader for, let's say, group 4. And what I'm doing, the way I'm controlling the platform is not too good for the members. And one of the members finds it very bad and reports to the authorities. And then that person becomes a victim. Instead of analyzing the whole thing and then rectifying the issue with me, it's like because the authorities put me there, they can't even say anything. What I say becomes final. Is there something you can explain on that for me?
Well, the first thing we should understand is that human beings will continue to be human beings. Okay? Human beings, they will continue to be human beings. Now, most of you were applauding Prof. That you've never seen a professor who come to the level of the student to even negotiate a review timetable. For instance, under normal circumstance, the course was supposed to be Friday, Saturday, Sunday. Some of our Sabbatarians pleaded with him to look into it. He being, this young man, if you look at his credentials, you could see that he has gone through a lot of classrooms, met a lot of lecturers, and he has learned a lot. Don't forget that he is a chartered marketer. So he also understands human concepts and human differences. Okay. So even if he may be irritated by the way some of you talk, he has managed to master his emotions. So you see, because he listened to our Sabbatarians, now he are still in the class. If he has said that no, if I accept what Sabbatarians want me to do, our Muslims will also come on board, and the Christians too also come on board, and then eventually the whole class will become some way. So he has to apply his expertise in order not to ignore the minority, but bring everybody on board and try to satisfy not everybody, but halfway. Okay, so it is human nature. Okay, so there are certain people, when maybe they realize that people have discovered that what they are doing is not right, instead of them to do introspection, they will rather begin to fight. For instance, that is why in our part of the world, Africa, politicians are always fighting each other. When a particular government is in power, any suggestion, any idea from the opposite side is considered to be a sabotage, considered to be a weapon to bring down the ruling government. So they will never take it. Even if it is heading towards a ditch, they will never take it. They will only accept those advice when they lose power and they go into opposition. Okay, so human beings will be human beings. But strangely, some people are able to learn. For instance, I remember, I think a year ago, 2 years ago, some of the students were complaining that my quizzes are becoming too many. So they wish I could reduce it. I said, okay. So I even stopped giving out the quizzes. And then they went to write a mid-semester. And the questions that came in the mid-semester, they realized they could have solved it during the quiz. But I stopped giving them the quiz. So they themselves came back to plead with me to start with the quiz because writing the questions were difficult for them. Okay, so I wasn't irritated, I wasn't angry, but I wanted to listen to them. Okay, so it is incumbent any leader who want to leave a lasting impression on his followers, listen to his followers. After all, it is said in leadership, if you are a leader and the people you are leading, they are not following you, it means that you are just taking a stroll. You are just walking about. Because the people you are following, you are leading, they are not following you. They are just going somewhere and you are just there. Okay? So a leader is somebody who is able to influence his people to follow him. Without, not out of compulsion, not out of authoritarianism, but through lobbying, through engagements for them to come on board. So there are some people, when you draw their attention about what they are doing, they become irritated and crazy. Like we have our politicians. If, let's say, the economy is hard, and you go and say somewhere that the economy is hard, you are telling them how you feel. Oh. The followers or the sycophants of that president, they will come after you. Okay, so human beings will be human beings. Okay, human beings will be human beings. So that is just by the way. Let me move on. Let's look at
Dr. Ross. You see, sometimes we tend to look at the leader, but sometimes the followers too can be another problematic. You see, when sometimes the way you even present the case to your leader, you see, sometimes people can be something. Sometimes the worst what will come out of your mouth cries is insulting the person. So we must also, the followers too, you have a role to play. We all have a role to play, both the followers and the leaders.
Okay.
When you read Isaiah says something in Isaiah chapter 11, verse 6. When you read Isaiah 11:6, Isaiah said, and the wolf shall dwell with the lamb. How can a wolf dwell with the lamb? But he went on to say that, and the leopard shall even lie down with the kid. How can the leopard lie down with the kid? And went on to say that, and the calf and the young lion and the fatling together, and a little child shall lead them. And a little child shall lead them. So sometimes you would think that maybe, well, for instance, we are all in the class, and somebody, from nowhere, and you pick somebody to now become your leader or something, and maybe others will feel like, well, I'm even more qualified. I'm at a better position to do that thing more than the other person that was picked by maybe, So irrespective of the person who is leading, whether you are older than the person or that more they are older than the person, once the person has been chosen as the leader, you must give the necessary due respect to the person. You see, it's very important. So once your followers also give you the respect, yes, the onus also lies on you, the leader, also to also replicate back to them. But whereas the leader, sometimes the followers are also, giving you so much stress. If you are not careful, in fact, even God Himself in the Bible, it got to a time people were complaining too much. Sometimes, Charlie, you get pissed off and he said, Charlie, let me kill them. Then Moses will come and say, oh, please have mercy. You see, so we must we must all respect ourselves. Yes, because I think when we do that, I think we will all go far, and I think that's the only thing that me I have for. Leadership is right from the Bible, right from the biblical days. Depends on the type of leadership style you tend to deploy. So both the leader and the followers, we all have a role to play.
Yes,
so irrespective of the person who is leading us, we must honor the person. Yes, and then we shall all move, and the leader too, you must listen to your people. For that one, you must also listen whenever they bring they raise their issue, their concern, listen to them, and then you find ways and means and where and how to address some of these issues. And then, you cannot satisfy everyone. For that one, you cannot satisfy everyone. So that's the only thing I can say.
Okay. So, medical humanities will make you a practitioner. For instance, let's say the TMPC boss falls sick and he's rushed into your facility. Medical humanities will make you realize that, oh, but I thought Dr. So and so, you know all herbs, you know all medicine. How come you fallen sick? Medical humanities will let you understand that he's also a human being. Okay, and therefore human beings also fall sick. Can you imagine a doctor falls sick and the patient are asking, why do doctors also fall sick? Forgetting that the air we breathe in, the pollution in the air, both the doctors and the patient, we all inhale the same air. Okay, but you and reading psychology, you appreciate why people think like that. But those patients, they are not exposed to any psychology. They don't even understand why. So for instance, there's this thing that we got to know. There's this doctor who has a long queue anytime he's consulting. I mean, his patients believe in him. After a while, one day they were coming to meet this doctor, and they came to see his obituary picture on the consulting room door. I said, why? The doctor who has been treating us, he has rather died. Okay, psychology will make you know that, look, human beings, we are subject to many things. Okay, so let me look at the question that I brought on board, that discuss therapies that are controlled or influenced by the mind. Okay, because of time, let me shelve this, and then maybe next week we'll go into it, because I have just an hour. Let me finish with this part of the outline. Okay, all right. So let me share my slide. All right. All right. So last week we now centered more on the mind, the power of the mind. Okay. So this evening we'll be dwelling on more of the mind, and then I may end with our behavior. Okay. So as I was able to establish the foundation. Psychology is a scientific study of the mind and our behaviors. Okay, how the mind operates. Okay, and why we behave in a certain way. Okay, so there's this quote. In fact, I forgot to come out with the author. He says that once you control your mind, you can conquer your body. Okay, so as I said, for those of you who did the assignment about, let's look at the therapies that are influenced by the function of the mind. Okay, you come across a lot of therapies that comes under the domain of the power of the mind. Okay, and you realize one of them is about the mind-body therapy, where it tries to talk about you harnessing the therapeutic power or effect of the mind to influence certain physiological activities or physiological pathway in the body, where we say that the mind controls the body. Okay, so let's look at how does the mind. So in this evening, I'll be using the mind and the brain interchangeably. Okay, so as I said, the activity of the brain is called the mind. So both can be used interchangeably. Let's look at how does the mind or the brain controls the body. Okay. Now, please, if I may ask, let me go back. I think we said this the other time. Let me go back to the class and then ask this. Please, who can answer the organs of the body? Which one is considered to be the most important organ of the body? I think I said this when we came for the first 8, but I don't know if somebody remembers. Yes, Evans, your hand is up.
Yes, sir. The
Yes.
brain.
Hello? What did you say?
The brain.
Okay, would you want to tell us why? Evans, unmute your microphone. Okay, then let me move on. Mr. Soku Komi. Unmute your microphone, Mr. Soku.
Yes, it is the brain, sir.
Yes, why?
Because the brain controls every part of our body, our actions, our thoughts, and even our, I may say, our feelings. Is the brain who controls all these things. So because of that, the brain is the most important organ of our body. He controls our heart, and he is the brain who commands the heart to pump the blood to the other part of the body. Thank you, sir.
Okay, yeah, Mr. Afachao. Mr. Samuel Afachao.
Okay.
Yes, Mr. Samuel. Okay, we can't hear. We can't hear Mr. Afachao. Let's go to Eunice Tony. Eunice. Hello,
Hi.
Eunice.
Yeah, I also think the brain is the main organ that transmits information to the other parts of the body. So the brain gives us information.
Okay. So those of you whose answer up, do you have a different answer, or the same? Mr. Imano Dodu, is the same answer, or is you have a different answer?
Different answer.
Yes.
Because the
Now,
brain
what is
can
your
be
answer
sick.
first? What is your answer?
My answer is the heart.
Okay.
Because the brain can be sick, which causes neurosis. So when the brain is sick, you can actually suffer from neurosis or schizophrenia. You can get mad. But when your heart ceases, you die immediately.
Okay. So that is Mr. Dodu. Yes. Alpha and Omega.
Yes, sir. Thank you for the opportunity. I will choose the heart because the heart is the main engine of the body. It's the heart who supplies the blood, everything into the body. So I will go for the heart. When your heart stops, you are no
Please,
more.
I want water. Okay. 2. I want Eva Pure.
Hey, who is that?
Let me say the 2.
Eunice, mute your microphone. You want Evapure, eh? Thank you. Yes, okay. So Alpha and Omega, you're also saying is the heart, right? All right. So now, if you see an insane person, a mad person walking by the streets, the person is naked, dirty, eating from the gutter, waste bins from people. That person's heart is working well. All the organs are working well. But are you happy to see a human being behaving like that, Alpha and Omega? Are you happy to see a human being in that state?
I'm not happy, but anyway, we believe and there's a proof that the person can come back through the scientific means or anything, the person can recover. But
So
when
why
your
is the
heart
person why is the person's heart working normally? All the organs are working, yet he's eating from the waste bins of people, drinking water from the waste. And why is the person behaving like that?
because he is suffering from the brain,
He's suffering from
from his brain, but he's still
though
alive.
even though the heart is pumping well,
Yeah,
the heart is supplying oxygen to the brains, yet he's drinking water from waste water and
yes,
those
please.
things. So you think that person is okay, right?
Yeah, I think it's okay in another way, because
It's
why
okay,
I'm
eh?
saying that why I'm saying that even though he's drinking from the gutter, he can still come back. But if your heart stop pumping or supply anything to your body, you can't do anything. You can't. There's nothing you can do. You can't even drink in the gutter. Excuse me to say, you cannot even go to. You can't do anything. You can't even say I'm going to commit suicide. You are
Okay,
no
so
more. You are dead.
let me ask you this, and then maybe I'll move on because of many. How does the heart pump blood?
Ah,
Do you have any idea?
from the scientific background, I don't know much about the heart, but from the engineering background, that I'm speaking from the engineering background, that the heart is the main engine of a human part.
Okay. Electrical messages, impulses that pushes the heart to pump the blood. Okay. It is the brain that initiates those electrical impulses. Okay. The heart slows down, up and down. All those activities of the heart is under the regulations and control of the brains. So the brain is considered to be the commanding center of the body. Okay. The argument you are raising, it makes sense. Okay. That is the heart that pumps blood even to the brain. Yes. But even for the ability of the heart to pump the blood is initiated from the brains. Okay. So that is why you could see when somebody is in coma, okay, the heart may not be pumping blood, but they could realize that the pulse is there. Okay. So when somebody is in coma, the heart could be pumping blood, but at a very low rate. But the person is unconscious. Why? Because the part of the brain that should make the person come back into consciousness is down. Okay. So the most important organ of the body is the brains, and then followed by maybe the heart and other stuff. So that is why a human being.
Dr. Rose, I raised up my hand, but you didn't call me.
Yes, because of time. You relax, okay? When I finish and I open the doorway for questioning, please write your this and that, okay?
It's not a
Somebody
question, but it's not a question. I wanted to contribute to what the discussion, the most important organ and stuff. It's not a question.
Yes, I'm coming, please. I'm coming, okay? So hold your fire, okay? Who was that? Who? Mr. Who? Who said he wanted to contribute? Please, who?
It's me, Carl. I am.
Okay. Yeah, what do you want to say, please?
I also want to disagree a bit with the brain, because biologically there is no any known important organ in the body. Every part of the body is important. But when you come to perspective and scientifically, we want to look at it in the embryonic state before before you can say that something is important, we must look at it in a very serious and a different perspective. The heart form the heart cells and tissues and cells begin to form in 21 to 28, 22 days after the embryonic day. So if the brain is important, then it means that the brain should have been the first thing to form. The brain and the liver begin to form after 4 weeks, but the heart cells begin to form within 21 to 21 days of gestation. So I also want to a bit disagree with the people who choose the brain, because maybe we look at it after the human body is formed. But this one, we are talking about an important organ in the body, which is scientifically proven and known that the brain, the heart formed within 21 to 22 days after gestation, cross gestation. And so I'm finding it difficult to also believe that is the brain that is the most important, because if it is so, then embryonic stage, the brain should have been the first organ to form. That is my argument. Thank you. Though it's scientifically, but we can go into it and see.
Okay, so from your argument, because the heart came first, the heart is important than the brains. Okay, from your perspective.
Please,
Please, let's hold our fire. Please, let's move on. Okay. I need to complete this, so let's move on. Okay. All right. So let me go back into sharing of the slides, and let's move on. Okay. All right. So we look at the mind controls the body primarily through the central nervous system. Okay, that's the brains. So this is a complex network of nerves, neurotransmitters, and hormones that transmit electrical and chemical signals between the brain and the body. These processes regulate everything from environment and senses to autonomic function like breathing and heart rate, demonstrating a profound link where thoughts and emotion directly influence physical well-being. Okay, great. So let's look at it. Okay, so now where we are now, we are trying to look at how the brain controls the body. Okay, and then how we can harness these characteristics of the brains to influence the certain pathological or physiological pathway in the body and bring about health or healing. Okay, so now neurons, so basically, so those of you, I want to believe you are learning much of this under neuroscience. Okay, and then when you also go into anatomy, you also learn much about it. Okay, so there are billions of nerve cells. Okay, sending signals. Okay, both electrical and chemical signals right from the brains to all parts of the body. Okay, so this central nervous system is made up of the brain and the spinal cord. So it acts as a command center with the brain sending commands down the spine to the body. Then we also have the autonomic nervous system, which branches from the central nervous system. Okay, that manages or controls certain involuntary functions like the heart rates, digestion, blood pressure, stress responses, and often without conscious thoughts. Okay, so that is the question I posed. Okay, which is the most important organ of the body? Okay, so the mind profoundly impacts health through the mind-body connection. Okay, so don't forget that we are treating medical humanities, and under the medical humanities, we are now zooming into psychology, and we are trying to understand how the mind controls the body. Okay, and also our behavior. Okay, so we are delving much into the work of the brains or the mind. Okay, to understand how it's able to influence the body for the body to obey it well. Okay, all right. So the mind profoundly impacts health through the mind-body connection, whereas stress, emotions, and thought triggers physical responses like heart rates. Okay, like increased heart rate, weakened immune system, and inflammation, raising risk for heart disease, diabetes, and digestive issues. Okay, so what we also have to know is that, I mean, all of us being practitioners, we've come across what is known as positive mindsets and then negative mindset. Okay, so positive mindset and healthy coping, that is through exercise, social connection, improve well-being, while chronic condition can worsen mental health, creating a cycle where addressing mental state improves physical outcome and vice versa, affecting sleep, gut health, and disease progression. Okay. Okay, so we are still looking at how does the mind impact on our health. Okay, so one, it's able to do this through our thoughts, our emotions, okay, and even our belief system. And these can be measured, okay, through the actions of the person. It can also be the mind also impact on it through what is called the negative mindset. Okay, so chronic negative emotion states and stress can actively hinder physical recovery, weaken immune system. Okay, so chronic stress could lead to elevated level of stress hormones like cortisol, which can suppress the immune system and increase inflammation, slowing down tissue repairs and wound healing. Okay, what we are trying to say is that optimal health, or to achieve holistic health, we need to work on the mind. Now, I've come across people who have been booked for surgery, yet the surgery never came off because the surgeon realized that his patient was very, very anxious. In fact, the anxiety state of the patient has actually affected the pressure to go high. His stress level was also high. Okay, and the pressure was also high. And in such circumstance, if you try to go for that surgery, you may lose your patients. So most of the time, surgery is performed on a relaxed mind and with a positive mindset that, please do it, doctor. I know I'll become better after this surgery. Okay, so most of the time, surgeons will try to interrogate or engage the patient, his anxiety states. Okay, because the mind controls most of the activities, if not all. The heart rate, even look, the way even some of the tissue contracts and relaxes, how our blood vessels even contract and relaxes, are all being controlled by the power of the mind. If the stress hormones like cortisol, adrenaline are on the higher side, no surgeon want to embark on any surgery. Why? Because the anxiety state of the patient is so high. Okay. On the other side is this: when your anxiety state is very, very high, it can even weaken your immune system. Why am I saying this? But when you are very, very anxious, you elevate the level of stress hormones. And these stress hormones are known to fight the immune system. What do you mean by the immune system? I mean, most of the physiological activities in the body that builds into the immune system is being disintegrated and crashed down by the stress hormones. So when a surgeon, okay, or a doctor realizes that the person's immune system is down, they try to probe further. Is the person living a particular lifestyle which has increased his stress hormones? Is the person not sleeping well? Is the person living in a toxic environment which have elevated the stress hormones and therefore the immune system is down? There are certain conditions you keep on having infections, or you keep on reporting to the doctor because your immune system is down. And if for a good practitioner, apart from you trying to check through the medical ways, you need to use your medical humanity to understand the person you are treating. Okay, so it's very, very important. Okay, so we also look at increased pain perception. Now, when a person is highly anxious or is depressed or is always walking in fear, it can also intensify pain, okay, and even delay healing process. If the person is very, very anxious, the person does not understand why he should fall sick or go through maybe the injury he's gone through, it can also affect the healing process of the person. We also have detrimental behaviors, poor mental health. You see, the ability to cope with stress, okay, and not be also eating well, exposing yourself to toxic environments or certain behavior from other people can also affect your body that is going through any healing process to heal very, very well. Okay, so a positive mindset, hope, and an active approach to health can promote healing and improve outcomes. We also have what is called neurochemical release. Positive emotions, hope, and belief can trigger the brain to release beneficial neurotransmitters and neuropeptides such as endorphins, which are natural painkillers, and immune-enhancing molecules which support the body's healing mechanism. Okay, so if we're able to put the mind into a positive state, naturally, any pain in the body even calms down because these natural painkillers, they are called endorphins, okay, are released that can help you also overcome pain. All right. Now, there's also what you call the placebo effect. So the well-documented placebo effect demonstrates the mind's power to produce real physiological changes when a person expects a treatment to work, even if the treatment is inept. What they try to say is that as a practitioner, if you're able to manage and bring to rest or calm down the anxiety state of your patients, okay, even though the modality that you are using has no medical effects, it will work on your patient's health, all because you have been able to control the mindset of the patient to accept the modality you want to embark on. So if you go to the orthodox circles, for instance, there are certain patients, anytime they are not well, they believe that until the doctor gives them an injection, they don't feel that they've been treated well. But if the practitioner also realize that there's no need for an injection, sometimes, not all cases though, the doctor may want to inject what is called water for injection. It's a sterile water which is used in most sterile environments. The doctor can just release into the vein of the patient, even though they are not it is not medicated. And the person will feel that, oh, doctor, I realized that after the injection, I'm feeling better. Why? Because the mindset of this patient believes that if I'm not injected, I will not feel well. What we are trying to say is that as a practitioner, understand the mindset of your patient. Okay, sometimes we are tempted to follow it to bring about a positive outcome, which is very good. But sometimes to following it, if it will complicate the issue, you have to adopt a better strategy, okay, to calm down or bring the agitation in the person's mind to rest. So we look at some of the techniques which can be used to harness the healing power of the mind, okay? So one of them is, so integrating mental health strategies into physical rehabilitation can lead to a more effective holistic recovery process. So we look at this, mindfulness and meditation. These practices help to reduce stress, lower stress hormones, and promote a rest and digest state necessary for cellular repairs and immune defense. Now, when we go into details about this mindfulness and meditation, which is one of the modalities under mind-body therapy. Some patients, they have to be subjected to go through modalities like meditation, where they do introspection in a calm and serene environment. They go into themselves and realize that, look, the body has the capacity to heal itself. Therefore, relax. Okay, you let the person go into deep meditation, into the power of nature. When the patient goes through this type of therapy, I can tell you, even though physical medication has not been given, it improves cellular repairs and also enhances the immune system. There's another one called guided imagery and visualization. All this thing works. It uses the power of the mind to control the activities of the body. So mentally picturing the body healing or envisioning a healthy future can influence biological process and reduce pain. I remember one of the research work Prof gave it to us, I think in level 300 or so, we had to work on guided imagery, where you subject the person to begin to imagine. So for instance, the person is going through emotional pain and cannot sleep. The person is under depression, or the person is having high blood pressure and is confused, doesn't know what is happening to him. And you begin to subject the person through this modality called guided imagery, where the person is beginning to imagine in a world where there's no blood pressure, or the person begin to see himself that in the next few moments or in the next few days or weeks, he'll be living on this earth with that hypertension. How will he feel like? As soon as the person begin to imagine about these good feelings, about the immediate future, research have shown that the ability to calm down the pressure of the person become very, very drastic, and the person comes out of this kind of modalities and feels better. Normally, these kind of modalities are employed for people going through mental health issues like depression, anxiety, and a state of confusion. You need to employ the power of the mind. Okay, and normally you don't just read it. You have to also be a practitioner to be able to subject people through this modality for the person to go through a very holistic approach to treatment. Okay, yeah. So we also look at that be social support and therapy. Okay, so talking about anxiety and traumas, either with a therapist or in a support group, can improve mood and immune function and even enhance survival rates. Let me look at how our mind influences social health. Okay, so let me look at where we are now. So the mind powerfully shape our social health by influencing how we perceive, seek, and maintain relationship through thoughts, beliefs, and emotions. With positive outlook fostering connection, and negative ones leading to isolation, while our brain's chemical responses, that's the hormones, and learned social patterns like social media habits directly affect our social behaviors and well-being, creating a bi-directional link where mental states and impacts social engagement and social experience shape our mental health. Okay. All right. So let's go into it. So our thought and beliefs. Your internal dialogue and core beliefs, that is, I'm not worthy of a friend, dictates your self-perception, affecting your willingness to engage socially. Okay, and then we also look at emotional regulation. The mind controls your emotional responses and managing emotion like anxiety or loneliness. And this is crucial for healthy interaction. Poor regulation can hinder such connections. Okay, before I explain here, let me go into this part. Okay, let me go into our behaviors, and then I'll come back to how that this aspect also, the mind aspect, influences our health. Okay, so behavior is a range of actions, reactions, and conduct of living things or systems. in response to internal states or external stimuli, okay, or environment, okay. So this kind of actions or reaction, it is something that it could be observed and also can be measured, okay, and it includes everything from simple reflexes to complex choices driven by genetics, learning, and environment, and studied across science like psychology and ethology, okay. Like, so I try to make it in your slide, you realize that I'll try to explain what ethology is: a scientific study of animal behavior, okay, which is influenced by evolution, genetics, physiology, and environment. Okay, so we look at some aspect of our behavior. Okay, so our behavior is something can easily be observed, okay, and it can be measured. So it's what an organism does, like yelling, frowning, or walking, rather than just internal emotions, allowing for consistent study. Okay, so you can easily observe when somebody is yelling at something, or maybe a patient come to your consulting room, you're asking a question, all of a sudden the person frowns on you. You can measure such a behavior. Okay, all right. So we also look at what influences our behavior. Our behaviors are normally influenced by genetics, our environment, social interactions, learning, and physiological processes. All these things shape our behavior. Okay, so maybe by the time we close, we look at how our environment, okay, is able to impact on our behavior. Okay, okay. So we look at how our behavior. We look at our behavior and our health. So behaviors profoundly impact health by directly influencing disease risk, mental well-being, and longevity. Positive actions or habits like healthy eating, exercise, preventive care reduces risk, while negative habits like smoking, poor diet, inactivity, or what is called sedentary lifestyle or substance misuse can increase them, contributing significantly to chronic disease like heart disease, diabetes, even affecting mental state like stress, anxiety, and depression. What we are trying to say is that our behavior can impact on our health so much. Okay, so if you have a very good behavior or a lifestyle of eating healthy diets, embarking on exercises, okay, and living a preventative kind of lifestyle, if this is your behavior, the tendency of you living long or reducing the risk of certain chronic disease is very high, because this kind of behavior can impact positively on your health. However, if you also adopt a behavior like smoking, not eating well, you live a sedentary lifestyle, which is a behavior rather increases your risk of contracting chronic disease. Okay, so this tries to explain how our behavior also impacts on our health. Okay, so it's the same thing: nutrition, diet and nutrition, physical activities. Okay, right. Let me look at how. Let me look at social behavior. Okay, let's move on. Okay, now this is where I want to dwell on, and then maybe I'll end for questioning. Social environment and our health. Okay, now as I said, our environment impacts our behavior, or it shapes our behavior. The kind of environment you were brought up in will influence the way you behave throughout your lifestyle. Okay, so we look at what is social environment. It's simply everything made by humans that affects us, either positively or negatively. And this includes the people we know, families, friends, the community we stay in, or even at work, and the shared values and beliefs and cultures we live. That is, when you talk about culture, that is the way we live, the language, even the laws that governs us. The art is the human-built world of relationship, institution, the culture that shapes our behaviors, attitude, and identities right from birth, okay, until we grow up to become adults. Okay, so let's look at some of these social, environment. Okay, talks about social connections and support network. So a person who is surrounded with strong ties with family and friends, community, these provide emotional support and what is called buffer stress and encourage healthier behaviors, reducing risk of depression, anxiety, and improving overall longevity. Experience has shown that most people who are going through chronic diseases, those who are not able to survive, research have shown that it was because they lacked strong family ties and friends. People who come around them to encourage them, to show them love, to give them support in terms of visitation, talking to them with good words. Research has shown that it's able to increase their immune system and for them to survive through the condition they are going through. People who walk alone, when they are sick, they don't receive any form of visits from friends and families. Doctors have actually realized that their condition become worse and they are unable to stay even at the ER, the emergency room, all because they have been walking and living alone. Okay, so we are still talking about social environment, which shapes our behavior. Economic stability and resources. If your income, educational level, or your employment is of high quality, it can also affect your health. With high status linked to better health outcomes and greater access to nutritious food, safe housing, and healthcare. Now, where I work, certain patients who come there, because their company have designed healthcare packages, they are able to access good medicines. They are able to access certain specialist clinics, and therefore their health condition improves and they get healing faster. If you're able to afford nutritious food, now most of this healthy food we are talking about, well, some people would say that, oh, they are not that expensive. But if you want to eat some of these good vegetables and fruits, some of them come at a high price. Or some of these seeds and nuts that we introduce to our patients, if you don't have the means to afford them, it means that your health might deteriorate. So these environments can also affect your health. Community and neighborhood. When your neighbors, okay, or the environment you stay in is clean, free of microbes, stagnant water breeding mosquitoes, all these things can also affect your behavior. Because if you constantly fall sick and you are visiting the hospital, your confidence level, which is part of your behavior, goes down. We also look at our social norms and culture. Okay, if the environment you live in is full of fear and anxiety, they believe in superstition. They believe in superpowers controlling human beings. You're always living under fear, anxiety, panicking. It can also affect your way of life. Okay, so let's look at these social systems and policies. So if, let's say in a broader political systems, economic policies and social structures, this create a condition for health, determining access to quality education, healthcare, and safe living condition. What they are trying to say is that even the country you stay in, okay, if the healthcare system is very strong, okay, economic power, the economy of that country is very good, it means that your environment is also good. Okay, so, and in most of the countries where life expectancy is very high, their the economy is also very, very good because they have access to, good food, access to good water, access to good healthcare, and therefore it also improve on their healthcare system. Okay, now there's this question I want to put across. Please, class rep, you can take a picture of it and then maybe post it on the page. So Mr. Siedu is working under a strict, inconsiderate, unfriendly, and callous manager in his place of work. Discuss how such a toxic environment can impact on the health of Mr. Siedu. As a naturopath, explore practical ways to help Mr. Siedu to contain this situation and live a healthy life. Okay, so let me see. What is the time? Okay, let me see. Okay, great. So let me conclude on this. So good behaviors or lifestyle is a choice, and human being could be told to adopt them for optimal health. Example: regular exercise, healthy living, sufficient sleep, positive thinking, strong relationships, and avoiding smoking significantly boost physical and mental health, preventing chronic disease, for instance, heart disease and diabetes and cancer, reducing stress, improving mood, increasing lifespan, enhancing overall well-being, with behaviors being a major factor in health outcomes. What this page is trying to say is that our behaviors can also impact on our health. The choices we make to live a healthy life, therefore exhibiting good behaviors, impact on our health. One day I was eating in my office, and then my doctor came and saw what I was eating. When he looked at the food I was eating, the doctor made these remarks. No wonder, Mr. Ross, you are always healthy. Okay, so our behaviors and our mindsets can impact on our health. So the patient who come to our facility, please, apart from requesting for laboratory investigation or any medical imaging, we are expected to use medical humanities skills that we are learning to probe into their mental health, emotional life, and mental mindsets or mindsets. It's very, very important because it also controls their health. The mind controls the physiological and psychological pathway in the body. So if we're able to harness the power of the mind, our body will also respond to it and they behave well. Okay, so this is another assignment I want to put across. Class rep, you can take a picture of it and post it on the page. In short sentences, discuss how these good behaviors or lifestyle, that is positive thinking and exercise, impact positively on our health. In short sentences, discuss how these behaviors or lifestyle, that is positive thinking and exercise, impact positively on our health. All right, thank you so much. And then I'll now open the floor for questions. Prof, maybe I don't know if you have any comment to make. Thank you so much.
Okay, I think let's accept their questions first. Then,
Okay.
After question.
All right. Thank you. No, I'll add this to the one we couldn't. In fact, we would discuss it in class, okay? Or discuss it in class. So please, as I keep on telling you, these assignments are meant for you to work on to stimulate your reading skills and acquire the knowledge and prepare yourself. Who knows? Maybe the end of semester exams, they could come. Okay, so we'll discuss them in class. Maybe hopefully in the next week. Thank you. All right. Yeah, Madam Ingrid, your hand is up.
Hi, good evening, Prof, and good evening, class. Thank you so much for that
Good.
presentation again, and for that encouragement as well. I needed that. Anyway, so I wanted to comment on the discussion on the head
Please,
and heart.
Madam
Can
Ingrid,
you hear me?
Madam Ingrid, your voice is not coming clear. I can
Oh,
hardly hear you well. So if you
oh,
could position yourself well,
okay. Is it any better?
I think it's better than before.
Okay, okay. Can you hear me now?
Yes.
Yes, I was saying thank you very much for that presentation and
Great.
encouragement as well. So I wanted to contribute to the
Okay.
discussion on the head and the heart organ. All organs, of course, are important, but the body cannot live beyond the heart, the brain being dead. And that's why they talk about being brain dead. Yes, the heart is extremely important, but the heart, as you rightly said, takes signals from the brain. And for the comments regarding the baby, the formation of the fetus and the heart being formed before the brain, I just wanted to comment, just my thought, that the fetus takes its brain signals from the mother, so it's not taking it from its own brain because it doesn't have that developed yet. So I just wanted to make that contribution. And another thing is that you can have a heart replacement, but to my knowledge, you can't have a brain replacement. So the final death is really with the brain. And so I think the brain is takes the lead in terms of the most critical. Thank you.
Okay. Thank you. Yes. Any other contribution? Any question? Any comments? Okay, Mr. Imadodu.
Thank you, Doc. God bless you for such presentation. Please, if I am coming from poor, wicked background and I am not educated, how can my environment influence my thinking? That's my question.
If you are coming from a very poor and wretched environment, right?
Yes, yes, and not educated. How can
Uh-huh.
my environment influence my upbringing or my way of life?
Okay, great. Now, our environment influences everything about us. Okay, so in the first place, I've seen some people who were actually brought up in a very underdeveloped environment, but because their brains were very good, what actually brought about the turnaround or the game changer was that they were able to pass their exams at the basic level, and that shifted them or catapulted them to a good school in the city. Okay, for them to have a good exposure. Okay, now if this child, I'm just giving giving a scenario. If this child who is very intelligent, after passing exams, is unable to get the needed support to be moved to experience higher level of education and stays in that same environment, in fact, experience has shown that they are unable to develop any further. In fact, their life even deteriorate because exposure in life enhances most of your developmental activities in your life. I know of a guy who was in a village here, Tema New Town, Well, it's not a village actually. The guy was very brilliant, and he wrote a BEC and he passed. In fact, he even got a scholarship from the government. However, for his parent to even get money to board transports, to go to the secretary, the scholarship secretariat, to go and confirm or receive the scholarship became an issue. So he took a neighbor who took this guy, a neighbor in the church, who took this guy to the scholarship secretariat. In fact, on the day the deadline was supposed to have reached to receive the scholarship, fortunately, this guy went to a very good school in Accra, and he became a pharmacist. And now he's making waves. He's making waves. So, to be very honest with you, if you want to excel in life, and you are coming from a very poor background, destiny will have to come on your way to cross your path, where you meet somebody who can lift you up to a better environment. Because even if you are intelligent and the environment is not changed, in fact, you can even deteriorate and you may never see any progress in your life. Okay, so Mr. Imadodu, you have to associate yourself with people who can expose you to a better environment, that will expose you to learn better things, especially through education and schooling. Because if you are in a village or in a deplorable, village, if that village can develop, people in that village have to be sent to a higher level of education. They go and learn their skill, the techniques, and then they come back to the village to come and change the mindset of the people. Because if you don't change the environment, it will be difficult to even bring development. That is how African is still in this state, because people's mindset is difficult to be changed. It is so ingrained that when their own relatives or indigents, they travel outside and they are bringing good development, things that can bring progress into their society, they don't want to accept them. They want to live in their own states and become difficult to see progress and development in their life. Okay, so this is what, I don't know, maybe Prof may want to add something to it. Prof, maybe, and your closing remarks too, Prof.
Okay, all right. That's a very interesting question. Is it Mr. Afacha or Mr.
No, Mr. Imadodu?
He always asks interesting questions. Yeah, anyway. As for success, from poor background, you need. I always say, if you are from a poor background, like somebody like me from Brodowa, from Berlin, you don't need anyone to motivate you to succeed. You have to motivate yourself. Apart from it's between you and your God. So, no one. God has life itself. Well, all depends. You must also, as I said, motivate yourself. Know that it is possible. Whatever you aspire to do, you can achieve. That's the only thing I can say. As for success itself, there is always a spiritual battle. For me, that's one thing I have noticed. All these big people, all these big companies, the people leading all of them, they have their spiritual background. They have come from God or from other sources. Yes. That's one thing people will not tell you. For me, Christ has been my source of spiritual battle. I don't have to do that thing anymore. All right, so the other thing is I want to draw your attention to the college structures, our management team. The registrar is the pillar in every institution. When you go, the registrar is the pillar. So you must, especially the class rep, and all the leaders, whether as SRC, whatever, you must always make sure you work harmony with the registrar. Yes, you cannot bypass the registrar to the president. It is not possible. So, yes, the registrar and course rep will always live in harmony, with peace, be able to go through. But at the end of the day, the registrar that will sign most of your things, will endorse most of your academic, activities and all that. So if you have a problem, please contact your class rep. It is the duty of the class rep to contact the registrar. Even if you contact Madam Tina, who is the course rep, at the end of the day, Madam Tina has to discuss with the registrar, and then the registrar will get back to him. Yes. So even though the registrar will part or is a member, is also taking part in the program, doesn't mean that you have to look down on the registrar. Yes, I have to be honest with you. Yes. The fact that the registrar is also one of your colleagues and is taking part in the program doesn't mean that you have to look down on him. Yes, he's taking part in the program, but he's the registrar. So at the end of the day, yes, whatever decision you take, whether you are the SRC president or the course rep, you must always be in touch with the registrar. So if the registrar and the course rep and SRC, they are fighting, and then I don't know where you are going. So please follow the structures. Let's all follow the structures so that we can